Well, one of the most important things I think we underplay in New Zealand is the importance of the treaty in our historical narrative and the way a contemporary application of that could actually make sense for us today. And the subject matter that I was talking about today with Healthcare Aotearoa and its emergence as a bicultural network which fundamentally shifted the way primary care was structured and delivered in the country in 10 years is an example of where you take a indigenous way of thinking and apply it to a matter, in this case the primary healthcare delivery, and by actually understanding that as New Zealanders we have a particular way of seeing the world, we can provide a more just, equitable and more efficient way of delivery of the care. And so the Healthcare Aotearoa example was around changing a model of care from being individually focused on doctors and nurses to being teamwork focused, from changing the ownership of primary care to being one where community who were being served had a say in how it was operated, changing the model of financial delivery from episodic fee-for-service through to a population or a capitation-based funding approach, and actually looking at seeing whether by improving the access, affordability and the cultural intuitiveness of the care being delivered, you could actually provide a better health outcome for all of New Zealand. And the evidence 10 years on from the contribution that's made to the change in the primary healthcare system is that those things have been achieved. The process should never be a compliance exercise. This is about willing partners at all times. And if you think about the genesis of the treaty, it was entirely about willing partners. No, this is much more about us being clever about our own historical narrative and bringing it to play in much of our public life. We see it now in the major political alignments going on at the moment where in an unusual setup, the National Party have taken the Māori Party as part of its coalition grouping, something that would have been perhaps unheard of 10 years ago or 20 years ago. Here's a situation where people see the value in the different perspectives that are being brought to bear. It's not the question of how many people each level of adherence has, it's a question of how accurately we describe and respond to what are uniquely New Zealand features, and fundamentally being part of a Māori, Pākehā and more multicultural contemporary community as part of our historical authenticity.